This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
So I'm going to talk a little bit about something that we don't see a lot here every day, but and I'll explain why, but it's serotonin syndrome. The big thing with serotonin syndrome, one of the bigger drugs that can cause it are monoamine oxidase inhibitors, which alter the metabolism of serotonin. Those are not really given anymore. They're really for refractory patients, refractory cases of depression nowadays. But there are a couple of other drugs that have monoamine oxidase inhibition. Does anybody know of any of them? There's an antibiotic specifically that can have some monoamine oxidase inhibition. So it's Linezolid, which is kind of like a last line antibiotic for people with penicillin allergies. Uncommon one, but it has monoamine oxidase inhibition in it. So people on SSRIs that might get this antibiotic could develop serotonin syndrome. Another one to look out for is Dextromethorphan, which is a cough suppressant, right? It's an over-the-counter cough suppressant, which can also induce serotonin syndrome, especially in people that are taking SSRIs. So some of the symptoms that you might see with serotonin syndrome are mental status changes, autonomic dysregulation, which can be vital sign instability. You can have like hypertension, and then it can go into hypotension, then hypertension. Same with like heart rate, it can go up and down. The other thing is hyperthermia. You'll see that, so a really elevated temp. And then a big thing is also neuromuscular hyperactivity. So you might see things like clonus, you might see a Babinski sign, or any sort of like hyperreflexia. And do you guys know what the treatment is primarily for serotonin syndrome? Anybody? No. So you really, first line is kind of supportive care. So you want to treat their blood pressure if they're hypertensive. And then if they're agitated, you just want to give them some benzos. What about if they're hyperthermic? Do you guys know what to do for that? No? So really just the benzos treat that, because actually the hyperthermia is coming from the muscle rigidity. It's not a central hyperthermia, so most people might think like an antipyretic, but you actually don't give that in serotonin syndrome. You want to just treat that with benzos to treat the muscle rigidity. If they're refractory to just kind of supportive care measures, then there's a medication called cyproheptadine, which is a serotonin antagonist that is used as second line for serotonin syndrome if the supportive measures fail. One last thing too, if the patient has a temperature greater than 41.1 degrees Celsius or 106 Fahrenheit, then they're at risk for respiratory failure. So then you initiate rapid sequence intubation in those patients. Yeah. Any questions? Good? Cool. Thanks.
Hell yeah. We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.